Heart failure is so hard. It can really affect so many parts of somebody's life. And to adequately address it, you have to look at the diet, what they're eating, the medications that they're taking, the compliance with medications. And moving from somewhere in the hospital where it's such a high, intense care model, it can be very daunting for patients to move to the home and have to try to do that all on their own. And that's where I think these models where we're having some sort of transition into that home setting to really be focused on the specialty of heart failure. And we really love to be able to have these people stay at home and thrive at home and not really have to come back to the hospital. To have the tools and the knowledge base in order to do that for heart failure is really important. Part of the core standards that are in this CHAP model for heart failure have to do with what aspects of care that empowers the patient that they can do at home, the family members, what sort of evaluation is needed, and when to refer back, and if they're not doing well at home and what to do then. My role in this was really to see that from a medical side and say, hey, are we up to date on the most current recommendations and guidelines? In order to better yourself in terms of how you can care for patients, you have to know how you're doing at that moment and to make tweaks and changes so that you can see those outcomes become better. And one of the outcomes that we really follow with heart failure is readmissions to the hospital. And tracking that as a care provider in terms of when you are successful, but when you aren't, so that you can learn from this, is really how we're going to take better care of our patients in the future. So I think a special disease program would be valuable to an agency as a way of differentiating themselves. Care providers and agencies really want to do well by patients, but medicine's become complicated and it's become specialized. To take the best care of a patient with heart failure, there's things that an agency would have to do really well and to follow those metrics in order to keep improving.
As a referring physician, would this impact your decision in where you would send your patients or what referrals you would make or recommendations?
There's a lot of very high-level specialized care that needs to be involved with heart failure patients and within cardiology, and to know that the agency has knowledge in that disease process, that has want to get better and follow their metrics to improve. This would really go far in terms of feeling comfortable as a provider with patients being involved with that agency's care. When I was asked to review the standards for the heart failure disease specialty program, a lot of what I was looking at is in terms of the different care that's specific to somebody with heart failure. So this looks different than other disease processes. Thinking like a cardiologist and trying to figure out what was best for a heart failure patient in terms of following this program. What CHAP's done very well is to look at this on an annual basis, update the requirements for their programs and agencies to reflect that change, and that kind of exciting time in medicine and cardiology where we're seeing benefits to patients every day that we didn't have before.